Colleagues, thank you so much for joining us tonight on the webinar. My name is Raisibe Madirwe, and I will be taking you through today's session. We will be talking about your compliance and also how you can make sure that you comply with your CPD entries, and also, most importantly, how you can make sure that you comply with your 2020 CPD entries. So in 2020, you were supposed to submit 6 CPD entries, and you couldn't do that. That is the reason that you were referred to the professional contact unit of the SAPC, and you were contacted by them, and they took you through the whole process on what needs to be done. But that was not a get out of jail for free card, if I can put it that way. You still need to comply with your 2020 CPD requirements, which you didn't comply with by then. And the system has been adjusted to make sure that you can submit your CPD entries per year of compliance if you are lagging behind. And we will be showing you that through this session. So we will again just go through the CPD requirements, the annual declaration and what it means and when it needs to be done, the designation, what is a designation, and also why did you receive the letters that were saying that you were designated as practicing for 2022. And we will go through the CPD essentials. We will also log in so that we can go through submissions of a CPD together, and also show you on which step do you get to choose the compliance here. So what are the CPD requirements? The CPD requirements for each and every pharmacist is that every year, by the 1st of February, you should have submitted your annual declaration, which is where you then designate yourself as either practicing or non-practicing. Practicing, which means you are offering the services pertaining or related to your scope of practice of a pharmacist. And non-practicing will mean that you are not offering any, not one, nothing, not any of the acts related to the scope of practice of a pharmacist. But as a responsible pharmacist or a tutor, or if you are both, you are not in any way permitted to designate yourself as non-practicing. Because the moment you do that, then the sub-role also comes to an end date. That will be meaning that you are no longer an RP, you are no longer a tutor, you are no longer offering any services that are related to the scope of practice of a pharmacist. So as a responsible pharmacist, as a tutor, you are obliged to make sure that on a yearly basis, you comply with the requirements to ensure that you keep your sub-roles. So you need to submit 6 CPD activities, and this cannot be submitted manually. We have had on a few occasions where we get pharmacists sending us certificates to say, I have attended the seminars, I have done this or that. please take this as my CPD submissions. It doesn't work like that. You need to log in on the CPD system and submit an entry. And also you are required to do not upload your evidence, but you are required to maintain a portfolio of evidence, which should be electronic, should counsel request that from you. So this will be upon random audits. We're not requiring it for you to give it to us at the moment, but we could on different occasions request you to submit your evidence. And as a way of making sure that you don't lag behind, making sure that it's not a burden on you, you are advised to submit at least one CPD entry every second month. So if you do that, by the end of the year, you will have 6 CPD entries. This is to avoid the last minute rush, to avoid the system glitches that we had in the past few weeks, because it was the due date was coming, and a lot of people tried to submit their entries and we had system clock ups. So please try and submit one CPD entry every second month to make sure that you do not lag behind. And this was the reason that we have sent you an email last month that was showing that for 2021, you have submitted this many CPD entries. You were required to submit 6, but you only submitted, for example, 4, and you still have 2 to go. And then for 2022, that email was sent in April. You were already on the 4th month. So if you were doing it, the one entry every 2 months, by then you would have submitted 2. So that email came in saying 2, you have submitted 0, you are required to have submitted 2. So that was just a reminder to keep you in check, to remind you that this is how it can be done. So the annual declaration, I'm sure most of you have done this. The annual declaration where you go through it and eventually designate yourself as practicing. That was informed by the competency standards, which were approved by Council in 2018. Those competency standards are made up of 6 domains, which have competency standards and which are divided into behavioral statements. And the behavioral statements are not trying to distinguish pharmacists by their level of employment, but it's more the level of the knowledge that you have in that particular competency standard. So you choose a behavioral statement that is applicable to you at that moment. And this will then result in a designation. So if you go through all the competency standards and you select, I never do this for all of them, it designates you as non-practicing. And if you as much choose 1 or 2 of those, then it designates you as a practicing pharmacist. And what happens is, if you do not designate yourself by the 1st of February of each year, Council will then designate you. So how we designate you is we go and check your compliance status. If you have complied with the 2020 CPD requirements, for example, and it's the year 2021, we will then designate you as practicing for 2021. For 2022. So for now, for those emails that we have sent out, we have checked them compliance status for 2020 and the compliance status for 2021 and designated you as a practicing pharmacist for 2022. So whether you have designated yourself or not, if you decide not to designate yourself and you don't have a sub role, we then designate you as practicing, and therefore you are obliged to submit 6 CPD entries for that year. Unless you go on the system and update the designation, change it to designate yourself as non-practicing, that will be your choice. But as I have said, then all your sub roles will fall off. But for people who then do not have any sub roles and they are not practicing, they can then designate themselves as non-practicing. Okay, this is what I was explaining to you now. Now, what practicing means and what non-practicing means. So practicing means that you are providing one or more of the services pertaining or related to the scope of practice of a pharmacist. And non-practicing means you are not providing any of the services. You are not performing any of the acts that are pertaining to the scope of practice of a pharmacist. And then the CPD essentials, as I've said, it's very important that you familiarize yourself with the competency standards. Make sure that you understand them. Make sure that you go through them and check what are your knowledge or skills gaps so that you can ensure that you fill those when you eventually do your CPD activities. So the terms to remember are the domains, competency standards, and the behavioral statement. So each competency standard will have an introduction to the domain. That will be where we are explaining what that domain is all about. What does it mean if you are competent in that particular domain? How does it apply to you as a pharmacist? And then there will be the competencies, which will then go into further details of what is expected to you if you are a pharmacist that is providing services that are related to that particular domain. And the behavioral statements, as I have said, they are in different levels depending on the depth of the knowledge that you have with that particular domain or the depth of your practice or the services that you are offering. And the domains, as I've said, that we do have 6 domains, which are the public health, safe and rational use of medicines and medical devices, supply of medicines and medical devices, organization and management skills, professional and personal practice, education, critical analysis, and research. And what is surprising to us is that you will still have a pharmacist that will come and say, but I don't work in retail or I don't work in hospital. When we have all these domains, which covers all the sectors of pharmacy in South Africa. We will give an example here with the public domain and what it means and what are the competencies that are expected of you if you are practicing or offering the services that are related to public health. So this domain applies to all pharmacists whose practice includes the promotion of health and wellness through the provision of healthcare information and education to the public and other members of the healthcare team. So this includes almost everyone, because if for example you're working for a medical aid and you are the one that is deciding which medications the medical aid can pay for instead of the most expensive options. It will also apply to you. If you're working in manufacturing, you still need to provide information on the kind of medications that you are offering, the kind of medication that you are producing. So the competencies that are in here is promotion of health and wellness, medicines information, professional and health advocacy, health economics, epidemic and disaster management, primary health care. So as a pharmacist, you will go check the behavioral statement and choose ones that are more applicable to you or that are of interest to you. And then the frequently asked questions will be where a pharmacist is asking us, I do not work directly with patients. Why am I being obliged to comply with the CPD requirements? I only develop regulations. I only write standards. I'm just doing research. I only train BPharm students or pharmacist assistants. Those kind of things. And the fact is, pharmacy is not only restricted to the provision of direct clinical care. You can be providing any kind of pharmaceutical care. You are a pharmacist and you are practicing, and therefore you are obliged to comply with the CPD requirements, because the whole aim of having CPD and implementing it is to make sure that as pharmacists, we are out there learning, and to make sure that the information that we provide to the public is the correct information. In a way, we are uplifting the profession of pharmacy. We are making sure that the public trusts the pharmacist to provide them with proper services. And then how do we learn? So before we can get into depth with how do we learn, let's first define what is a continuing professional development. So this is the process by which registered persons maintain and enhance their competence throughout their professional careers. So it's a way of making sure that you are enriching your knowledge, making sure that you are filling your skills gaps, making sure that you, in a way, make yourself indispensable, making sure that if you need to do your work, you do it with quality. So that is the whole reason that we are doing continuous professional development in pharmacy. And then the submission process, we do have the two different cycles. We have the 4-step cycle, and this one, I'm going to log in shortly so that I can show you how it works. But the 4-step cycle, you don't have any limitations of the number of activities that you can submit. You can submit 50, you can submit 60. We do not limit you. But this one requires prior planning. You need to first sit and decide what is it that you want to learn, how are you going to learn, and after you have learned, how are you going to implement what you have learned? What are you going to do with all the knowledge that you are going to learn? It allows submissions once you have completed all the steps. So it doesn't allow shortcuts. You cannot do just the one step and be able to submit. It doesn't work like that. And then we do have a 2-step CPD cycle. And this one, you are allowed to submit only 3 CPD activities per year. So how this one works is that it doesn't follow any planning. You don't need to plan, you don't need to outline. It can happen that you're sitting with somebody sharing information and you realize that actually I've learned something from this, and then you go log in and you tell us what you have learned. It is limited to 3 CPD activities per year, as I've said, and we cannot give any more. So it's only 3. So it's up to you if you submit 3 of the 2 step plus 3 of the 4 step in order to make your 6, or you can submit all your 6 from the 4 step cycle. It's all up to you. So the 4 step cycle consists of reflection, planning, evaluation, and implementation. And the 2 step one is only the evaluation and the implementation step. So I am going to log in on the system, and then I would like for us to submit one CPD together using the 4 step cycle. Okay, so I have logged in, and this is how your CPD system will look like once you have logged in and went on the CPD page. And for me to submit a 4-step titled CPD, I will start at the reflection, and then it says here, identify a new learning need. And then I will go, and then I will select a domain that is related to the kind of work that I'm doing, or that will feed my knowledge gaps that I'll be having at that particular moment. So I'll choose under education, and then it's education and training or gap analysis. You can choose whichever is applicable to you. I'll choose this one. And then you need to give it a title. So ensure that the title that you are giving is appropriate and relevant to the domain, and that title is what you have selected to learn at that particular moment is filling in your knowledge and all the skills gaps. So let's say drafting of an SOP. Okay, so for example, I'll make that my title. And then what was the learning trigger? What made you want to learn? So I can say that competencies, and then is it related to the current role, the new role, or is it both current role? And then was it initiated by your employer? Was it initiated by perhaps a user of your service? Was it initiated by colleagues, your peers, or by you? So we will choose myself. And then for the sake of this training, we will just write test here. And then you save. And then it asks you, would you like to continue to planning? If you would like to continue, you press yes, but because we are learning today, let's start with by saying no, and then which means you can come back to it at a later stage and continue with it. And when you click on it, this is what it will look like. If you click on edit, it will take you back to the reflection step. And if you just want to continue without editing the previous step, then you will just proceed. So I'm proceeding to the planning step. Is it measurable? Is it non-measurable? Is it structured? So non-measurable is any activity that didn't follow any formal structure. It could be that you read an article, you read a book to remind yourself, or you were reading a journal to get that knowledge. And then the measurable ones is if it was a short course that is less than 6 months in duration, it could be anything, or if you were attending a conference. And then the structured, this is for any course that has a duration of 7 months or more. So it could be anything. It could be a postgraduate diploma. It could be that you were doing maybe PCDT or the PMAT course. It could be anything at all. So you choose what will be applicable to you at that moment. And then here, was it a self-study? Was it casual reading? Was it an event that was presented to you? Breakfast meetings? It was a self-study. And then here you choose the duration of time that it took. So when did it start and when did it end? You then go here and provide the date that you have started, and then in here you provide the end date. And then for the purposes of this, we will save test so that we can save time. And then we save, we continue to the next step. And then when you get to the next step, it has here saved the information that you have previously entered. So you will not need to repeat that information. In here, you only give us the duration of the activity. Did it take you 30 minutes? Did it take longer? Then you select which one that is applicable, and then we save. And then it takes us to the evaluation step. And then the evaluation step, this is where then you evaluate what you have learned. Did you meet the learning objective, or do you still feel that there is lack of knowledge, there is lack of skills that is related to that topic that you need to go and do some more research or do some more study? You choose what is applicable to you. And have you applied it? If you have applied it, was it applied in your workplace, or have you not yet applied it, or was it applied outside your workplace? Then you select one that is relevant for you. And then reasons why your learnings were not met, then you can select here that I was unable to find the relevant provider, or I was unable to find a course, or I just didn't have enough time. Okay, we will choose that one. And here is the most important part. That is a new development that we have, where you are then allowed to select the year of compliance. So your year of compliance is the year in which you want to comply with. So if you still need to comply with the 2020 CPD requirements, you will choose here the 2020 year. And then you will describe here what you have learned. So if it's 2021, you choose 2021 or 2022. And if you do not select a year here, it then automatically defaults to the current year. So you need to make sure that you choose the correct year. Otherwise, it will default to 2022 since we are in 2022. And then when we get here, you can select if you want to save this CPD, and if you save it, it will not submit itself for compliance. And then when you go back, you'll find it here waiting for you to submit it. We have received various queries where pharmacists are saying, but I have submitted it. Why was it not submitted? And at that time, the entry is awaiting submission. So please make sure that you have submitted, because if you don't, it will then await submission. So there are different options of submitting. You can submit it for compliance, or you can submit for peer review. Peer review is where you choose one of your colleagues or somebody that you trust has more knowledge than you in that particular subject to review the entry that you have entered. And this is voluntary. You are not obliged to do it. And also, if you do it and the person ends up not having time to review you, it's okay. It's not train smash, because it then has a parallel submission. It will still be submitted to council for compliance for that particular year that you would have chosen. So we will choose, for learning purposes, let's choose submit for peer review. And then here, if you already have peers that you have allocated to before, you will be able to select. Otherwise, if you don't, then you can click in there and then put in the person's P number. Then it will allow you, it will then alert that person that they were chosen as a peer to assess your work. And then they will be able to assess your work the moment you then go and activate them too. So if you had activated someone and then you feel they are done with what you needed them to do and you don't need them to be your peer anymore, you just log in and then you go to the peer review step. And then just a moment for me. You go to my peers, and then here you can be able to deactivate them. Once you deactivate them, they will not be able to review any of your submissions. So we're going to go back to my submissions so that we can submit. Just a moment for me. So we are submitting. And then that CPD entry has been submitted. So it will still show the submission dates there, so that we can know on which date was it submitted. But it will also reflect under the submission year. So I'll just go back to the main slides. This we have addressed. This are the non-measurable learning activities, which is self-study, a case study, conference attendance, talking to your colleague. And these are the measurable ones, the short courses. Or if you are reviewing an article, or if you were invited as a guest speaker, perhaps for a conference. And then there is the structured ones, which are the ones that you would register yourself for a course that is over 7 months in duration. And then the portfolio of evidence. Make sure that your evidence is current of the current year. If you are submitting for 2021, you cannot be having evidence that you did the CPD in 2020. It has to be something that was done in that current year. It must be valid. It must be relevant to the topic that you have chosen, the domain that you would have chosen. And please do not upload your evidence on the system. This evidence, we request that you keep it in an electronic file in case council does request it from you. So as I've requested, it should be related to the current year, and your evidence can be anything. So for example, if you were saying that I needed to learn 1, 2, 3 so that I can draft an SOP, you can use your evidence as that particular SOP that you have drafted. Or if you read a journal, you can use that article as your evidence. Or if you attended a webinar, then you can use that as your evidence. You need to make sure that it's current, it's valid. And then this is how the old CPD annual declarations looked like. We have changed this to make sure that you are now able to view your own CPD entries for that particular year. So it now looks like this. So I am going to just jump quickly and go to where I have logged in so that we can just quickly do it and you will be able to see. Okay. So that slide, you find it under annual declarations. And this is what it now looks like. So if you had submitted CPD entries for 2020, it will be able to show you that you have submitted 13 for that year and you are able to view those entries. And I just want to quickly explain to you what this ES means here. So this, if it says under complete, yes, it would mean that you have actually submitted your own annual declaration. But if we submit it for you, then it will be a no here. That will be showing us that you didn't submit your own annual declaration, but you were auto-designated. It also shows here that this person is practicing and they were self-designated and they actually complied with their 2020 CPD requirements. So how you view your entries, you will just click here and then you will be able to view all the entries that you have submitted for that particular year. As you can see here, it shows the entries that I've submitted in May, but I've submitted them for the compliance, the 2020 compliance year. So if you go and submit your 2020 CPD entries and you choose the 2020, you choose 2020 as your compliance year, they will be under the 2020 annual declaration, but they will still show the dates here that they were submitted in. So it shows here the entries that I've done for the 2021 compliance year. It shows me also the first submission date. And this one that is saying submitted for assessment, this one was submitted to a peer reviewer, but it still shows on the council side as submitted. So yeah, that's what I wanted to show you when I logged in here. I'll jump back to the presentation. Okay, so I've showed you that it will show your entries for a particular compliance year. These are the number of entries that you would have entered. It shows the domain that you entered the entry for. And if it was a two-step CPD activity, it will also show that it was a two-step. So when you get up to number 3, then it will not allow you to submit to a two-step activity for that particular compliance year. And then it shows you the domain competency. It shows you the title that you would have typed in. And then it shows you here the status, as you have seen on mine when I logged in, that it's archived. And if it was submitted for peer review and your peer didn't do it yet, it will show as submitted for assessment. But that doesn't mean it's not counting. And then it will also show you the submission date. So this we have been through when we did the 4-step CPD cycle, and I showed you how to select the year of compliance. And that if you do not select a year of compliance, it will default to 2022. And the CPD submission deadlines for 2021, the actual submission deadline was the 31st of December of 2021. Council gave a grace period that ended on the 30th of April of 2022. And that was extended by Council on Thursday. We sent out the letters today to say that there is an extension, and that extended grace period will end on the 31st of May of 2022. So if you do not yet comply with your 2021 CPD requirements, please make sure that you do so. And then we encourage you that for the 2022 compliance year, try and submit one CPD entry every 2 months, so that by the 31st of December of 2022, you do comply. And also, to those of you in here who still didn't comply with your 2020 CPD requirements, please make sure that by the 31st of May of 2022, you comply with the 2020 CPD requirements. So if you lagging behind on the 2020 year as well as the 2021 year, the 31st of May of 2022 is your deadline for both. And then the highlights for this presentation is that Council doesn't take CPD points. We do not take CPD points. Please make sure that you learn. And once you have learned, you log in on the system and then you share with us what you have learned. And no third-party entries will be allowed. You need to submit your own entries. There is no assessment for competence yet. We are only assessing your CPDs for compliance. And then, please, responsible pharmacists, please make sure that you do not have pharmacists who have designated themselves or that were designated by Council as non-practicing working in the pharmacies. So please make sure that the pharmacists that you employ, if you do have the powers to employ, are practicing pharmacists. And also we have made a link for attendance. So please make sure that you do fill in the attendance register. And also we do have the app, the registration mobile app, and that works as it has provision for the digital card, because council is no longer printing the physical cards that is saying that Resibe Madura is a pharmacist and this is her P number with a picture. Those are available on that mobile app. Please make sure that you upload your identity size pictures. Even if you upload it on the website, it will be visible also on the app. Please make sure that that picture is a picture wherein you are visible. Please don't put the flowers or sunglasses. You know, we have pictures where a person just put flowers or a dog. Please make sure that it's a picture of yourself. And then also, this registration app allows for you to amend your personal details, and it also allows you to submit your CPD entries. It allows you to check your compliance. It shows everything. It shows you the kind of the number of CPDs that you have submitted. So on the CPD system part, it works more like how the website works. And then we will open for questions. We will take suggestions. We will interact. So we're opening up the floor for questions. Thank you so much for setting apart time to come and join us on this cold evening so that we can learn together. We really, really appreciate you. Thank you. So we have a question from Facebook that is saying, I have a few learning activities on my dashboard that are incomplete, left with evaluation. When I want to finish evaluation of, it takes me back to the reflection or planning or implementation. Please do send us your P number. We will ask our IT guys to check if there is something wrong with the system or if it's possibly your network connection. But please do email us your P number so that we can be able to check. I will put in the email address that you can send to in here. And then question number 2 is, how can I change my primary sector in which I work as the option is blocked out? I am able to choose secondary sectors. As a tutor or as a responsible pharmacist, you cannot change your primary sector, because if you are a responsible pharmacist for a manufacturing pharmacy, that is the sector that is your primary sector. Or if you are a tutor for a community pharmacy, that is the sector that is primary for you. So this is the reason it's not allowing you. For pharmacists that do not have sub roles, they are able to choose their primary sectors. So unfortunately, if you are a tutor or a responsible pharmacist, that's the sector that is primary for you. Are there any further questions? We do request again that you do fill in the link that we have provided in the chat box as the attendant attendance register, please make sure that you do fill in the link. Thank you so much for joining us. In the absence of further questions, we will then close off the session. Thank you so much. Thank you. Goodbye.